This is Joel with Achieva Rehabilitation. I almost feel sad bringing this information because I'm almost forced to prove that the way we provide physical therapy and what we do for patients with our in-home physical therapy program is better than the majority of what's going on in healthcare today. We are a small company. We value a one-on-one connection with patients and families, and we value what their desires are. And for those reasons, we prioritize educating them and making them have a great understanding of what is going on and what needs to be done, because we simply believe that their time is valuable and their awareness, the patient and family awareness of why we're doing things and repeating information so that it becomes part of their life is essential to a great outcome when it comes to working with older adults who are struggling with their independence, struggling with mobility, getting around inside the home, outside the home, fearful that they are a burden to others. We deal with that all the time. So the majority of the healthcare industry, unfortunately, has evolved over time from a time when I was young and we had doctors like Dr. Holland in Mahanoy City, Pennsylvania, who would come to your house if you needed him on a Sunday. Healthcare has evolved all the way to the point where most providers are owned by a corporation or a large hospital, which is essentially a corporation. The patient has become less of a focus, and meeting the bottom line, ideally so operations can stay afloat, has become the majority of what pushes healthcare decisions. When it comes to providers of physical therapy, oftentimes the term physical therapy mill is used to indicate an entity that is just turning over patients and working quickly and that kind of a thing because they need to feed the bottom line. Now, there's a reason for this, and it's not all driven by the almighty dollar in terms of what the agencies are actually able to decide. It's really driven by economics. It's a simple income versus outcome function. What we deal with on a yearly basis in physical therapy and in healthcare in general are reduced insurance payments for the care that we provide. So in physical therapy, in my world, in a rehab world, we get paid less and less every year to provide the service that we provide to our patients. At the same time, the cost of providing that service is going up. Individual therapists want to earn more money. Building costs and other costs associated with running a business and overhead continue to go up. The result is that this physical therapy mill, this patient mill, is forced upon the decision makers. So clinics have to rely on volume of patients, so they schedule 2 or 3 patients at a time. So what that means is that you as the patient are sharing your valuable time and your health-related time, and more importantly, your physical therapist's attention with others. So where does this happen? As I noted earlier, it's not across the board. There are therapy agencies out there all across the world that pride themselves on making decisions primarily at the base of the patient's needs. So I want to respect them and not have this come across as being all-inclusive. But if there is a physical therapy provider, a clinic, that is generally part of a larger corporation, you will all know these because there are more than one clinic or two or dozens across regions. That's likely to be a agency or a company that has to do more decision-making based on finances rather than the importance of the needs of the patient. Also, outpatient clinics that are owned and run by large hospital groups, even regional hospital groups, often fall into this category. And the other is personal care homes. We would love to be involved in every personal care home because it is the group of patients that we love the most and that need our in-home program the most. But most of those personal care homes are contracted with the largest rehabilitation provider in the nation, who consequently ranks in the bottom 5% for company culture and employee satisfaction. So there's such an imbalance between business, patient care, and frankly, satisfaction of the providers of that care. To me, that's an imbalance that is unacceptable. So when there are other options available, even if they don't have billboards all over the place or a team of 4 or 5 people to come and promote their services to you, to a group of people in charge of a personal care home, things like that, it may be the better choice. So if you're getting therapy, we want Achieva Rehabilitation to be your top choice, obviously. But if you have other options that might fit in as well, or you're familiar with, you have to make sure that you are asking the right questions to make sure that they are going to take the best care that they can with you. And a few of those questions would be, how much time will my therapist actually spend dealing with only me and my needs? How much will I learn about my exercises, my treatment plan, and the root causes of the reason that I'm struggling to stay independent and mobile? If we don't teach our patients why they are struggling, why we are asking them to do certain things, they will never buy into it. And frankly, these physical therapy mills don't have time to do that because of the reasons noted. Will my therapist have time to answer the questions that I have or members of my family have? Again, it's about being there and being 100% present for the whole visit. In physical therapy mills, like we noted, it's almost impossible, even for a properly willing physical therapist, because they have to meet requirements that are dictated by somebody who may call himself a CEO. If I need health care, I am not going to somebody who calls himself a CEO. Now, with respect to my profession, physical therapy, every PT has great intentions. But these mills, these companies that prioritize cash over customer, profits over patient needs, and the dollar over, did you do everything you can to help your patient improve their life? That's where we want to differentiate your options. So let's talk about time. There's 24 hours in a day. Imagine you're trying to do something really physically difficult, a job around the house that requires a great amount of effort. You are allowed to choose one of two people to assist you. They both have an equal amount of ability to help you get the job done. But one of those options will spend 100% of his or her time with you and your job, and the other will spread his time between helping 2 or 3 people at the same time. Which would you prefer? It's a rhetorical question. Obviously, we know the answer. Achieva Rehab spends 100% of 60 minutes each time we work with our patients, only focusing on that. I talk about this a great deal. In our in-home PT program with Achieva Rehab, we work with people who are older, generally well past their 70th birthday. They have provided us a great education over years, but one thing is common. Most understand that time is the most valuable currency that we have. Because of that fact, we do our absolute best to give our patients all the time that they need to move toward the outcome that they want. We see our patients for 60 minutes, and since we only work in people's homes, they get all of that 60 minutes from us. That allows us to provide 2 to 3 times more individualized care to the patient. So think about that. If you're getting 2 to 3 times more care in your physical therapy sessions, that means you're likely to have an amazing result by 2 or 3-fold. And it's likely to happen 2 to 3 times faster. Again, time is the only valuable currency that we have. So the other thing we want to talk about is quality. Imagine, again, you're trying to do something really challenging. You bought something for your home that requires you to put it together. It's got a lot of instructions that you don't understand. You're allowed to pick one of 2 people to assist you. They both have an equal ability to help you decipher the instructions. But one will teach you in detail and answer any questions you have about the directions. And the other will simply jump to working on putting the product together without caring if you understand the instructions or details. Which would you prefer? The first person is taking time to help you understand what you're doing. The second knows 100% what they're doing, but they just jump in and put it together for you without you having a clue. Achieva Rehab spends a great deal of time educating our patients on what the root cause of their issue is, the detailed plan to address it, and why and how each intervention will help you get to the solution that you're looking for. So again, just something very important that we prioritize that cannot be prioritized in a physical therapy mill. Let's talk a little bit about convenience. So let's say you need to go somewhere, grocery shopping, you have to get ready to get there, you need a ride, perhaps somebody needs to go with you to help you physically with your groceries. You're allowed to pick one of 2 people again to assist you in this process. Again, they both have equal ability to make sure your groceries end up in your home for use. One will pick you up and drive you there and help a little bit with showing you what aisles to go down and helping a bit with bags to the car, and then drive you back home to drop you off to put your groceries away by yourself. The other offers to come to your house and make sure the groceries get there without you spending any additional time getting ready or traveling out of your home. So the second group is going to come to your house so that you don't have to worry about going out and spending the time to do the shopping yourself. This is not the best analogy, but I hope you understand where I'm going. Achiever Rehab comes to your home to work with you so that you don't have to spend extra time and effort getting ready for a physical therapy appointment, securing travel to and from, and the time that it takes to do so, and sitting in a waiting room where there are other patients vying for your therapist's time as well. I'd like to talk about machines. And this only fits into this podcast because a lot of doctors believe that machines are more important than anything when it comes to physical therapy. Now, granted, if you are 17 years old and you've had an ACL reconstruction and you're getting ready for your sport, there are certain times where you will benefit more from having therapy in a gym with certain types of machinery. But I will always challenge the thought process that goes through some patients' heads, a lot of doctors' heads, and a lot of orthopedic doctors' heads, that somebody who is an older adult who has never in recent times worked out in a gym with gym equipment actually needs that equipment to rehabilitate to their highest level of function. It's just not necessary. So we've been doing this for 7 years with our in-home physical therapy program. And we prioritize the spirit and the willingness of the patient. We prioritize the creativity of our clinicians. And we use, frankly, whatever the patient has in their home to improve their mobility, and it works great. There's almost not one single piece of equipment that I've ever missed. I want to leave you with maybe one or two final points on this podcast. I want to thank you for taking the time. Hopefully it was educational. Education is extremely important to me. Whether myself or my company is working with a patient under our supervision, or things like this podcast can reach people who we don't even know who will benefit from this information. And it helps them make better choices and make their lives better in the end. All of this education is worth it. We educate over and over, and we teach and we teach and we teach patients constantly. And I think that is one of the main things that separates our results from what you might get in a physical therapy mill. Remember, we are working one-on-one with no distractions, completely focused on one patient and nothing else for 60 minutes every time we see that patient. We're teaching, we're learning, we're watching, we're demonstrating, we're discussing, we're moving. All those things are way more important than machinery or being in a clinic or whatever your doctor might want that is not included in that list. Finally, please remember there's 168 hours in a week. If you find yourself still and not moving for the majority of those hours, it's inevitable that your capabilities will decline. So try and move more. When it comes to your health care, be proactive. Ask a lot of questions. Be a selector, a shopper of who is going to give you your therapy. And please remember my one rule of consistency. If you're trying to improve anything, or even just maintain any ability that you have, consistency is so important. I want to wish you well if you've made it this far into the podcast. I hope that you've garnered a lot of information from this that is useful. We would love to be an option if you or a loved one is struggling in any way as an older adult to remain independent, remain mobile in the community and safe, and enjoy your life, whether it's from a balance problem, dizziness, back pain, knee pain, post-hospital, weakness from immobility and COVID even, people not moving around, etc. We would love to be an option. Our website has a lot more information for problems you might be experiencing, and that is www.achievarehab.com. Our phone number is 888-929-7677. You can email us with questions. info@achievarehab.com. We're on Facebook. We're on Instagram. We're trying to find ways to reach as many people who could benefit from what we do. And we sincerely not only believe our way is simply a better way to help people with their physical struggles through therapy, physical therapy, but we have proof more than most people, most agencies. We have over 40 reviews on Google and dozens of other picture reviews on our website. We have handwritten letters. So we want confidence in what we can do for you, and we hope this becomes part of building that confidence. Please spread the word. Pass this along to somebody who may benefit from it. And I hope you are well. Continued wellness. Take care.